In the intensive care unit, mechanical ventilators are critical life support tools. Today, we're exploring one of the most advanced, the Hamilton G5. This guide will cover the features, functions, and clinical applications of this remarkable medical technology. The Hamilton G5 is a state-of-the-art ventilator designed for all patient populations, from neonates to adults. It provides both invasive and non-invasive ventilation, allowing clinicians to tailor support precisely to the patient's condition. At its core is the philosophy of intelligent ventilation. The G5 constantly assesses the patient's respiratory effort and makes real-time adjustments. This adaptive approach aims to optimize comfort, improve safety, and shorten the duration of mechanical ventilation. Its primary purpose is to provide life-sustaining respiratory support for patients unable to breathe adequately on their own. This includes those with conditions like acute respiratory distress syndrome, ARDS, severe pneumonia, or those recovering from major surgery. The G5 takes over the work of breathing, ensuring the body receives the oxygen it needs to heal. To meet these diverse needs, the G5 offers a comprehensive suite of modes, from conventional volume and pressure control to advanced spontaneous breathing modes that synchronize with the patient. This adaptability ensures every breath is safe and effective. In the upcoming chapters, we will dissect these features in detail. At the heart of the Hamilton G5's clinical power is its advanced visualization capability. The large, clear touchscreen doesn't just display numbers, it tells a story about the patient's breathing in real time. Its integrated graphics, waveforms, and loops give clinicians profound insight into lung mechanics, transforming raw data into actionable intelligence. We can instantly visualize the pressure time, flow time, and volume time waveforms. These graphs reveal critical details about every single breath, such as the peak inspiratory pressure, the presence of auto-PEEP, or the patient's effort to trigger a breath. Simultaneously, the dynamic loops, specifically the pressure volume and flow volume loops, provide a graphical signature of the patient's pulmonary status. A change in the shape of the PV loop, for instance, can immediately alert the clinician to a shift in lung compliance, while the FV loop is invaluable for detecting expiratory flow limitation or potential bronchospasm. This continuous, real-time feedback loop between the patient and the ventilator is fundamental to modern respiratory care, empowering clinicians to make informed, proactive decisions quickly and confidently, right at the bedside. Now let's delve deeper into some of the Hamilton G5's key features that leverage this data to optimize patient care. These intelligent functions are designed to enhance safety, improve efficiency, and support the weaning process. First is IntelliVent ASV-R, a highly advanced closed-loop ventilation mode. Think of it as an intelligent co-pilot for the respiratory therapist. It goes beyond simple automation by continuously monitoring the patient's respiratory mechanics, dead space, and crucially, their end-tidal CO2. Based on these inputs, it automatically adjusts ventilation settings, like tidal volume, respiratory rate, and inspiratory pressure, to maintain the patient within clinician-defined target ranges for both ventilation and oxygenation. This constant, subtle optimization helps to keep the patient in a lung-protective state, reduces the need for frequent manual adjustments, and can facilitate a smoother, faster transition towards spontaneous breathing and successful weaning. Building on that intelligence is adaptive support ventilation, or ASV. This mode is the foundation of Hamilton Medical's ventilation philosophy. ASV automatically determines and provides the most favorable breathing pattern based on the patient's lung mechanics. It encourages the patient to breathe spontaneously while guaranteeing a minimum minute ventilation. The ventilator calculates the optimal combination of tidal volume and respiratory rate to minimize the work of breathing, thereby helping to prevent complications like volotrauma, barotrauma, and auto-PEEP. It intelligently adapts to the patient's activity, providing more support when they are passive and less as they become more active, effectively creating a personalized weaning protocol for every patient. The G5's versatility extends beyond invasive ventilation with its integrated high-flow oxygen therapy capabilities. This allows for a seamless transition to non-invasive support using the same device. By delivering warmed and humidified air and oxygen at high flow rates, it provides comfortable and effective respiratory support for patients with mild to moderate respiratory distress, helping to reduce the work of breathing and improve oxygenation without the need for intubation. To create a truly comprehensive clinical picture, the G5 offers fully integrated SpO2, CO2, and flow monitoring. By connecting pulse oximetry and capnography sensors directly to the ventilator, these vital parameters are displayed alongside all respiratory mechanics data. This integration eliminates the need for separate monitors, reducing clutter at the bedside, and, more importantly, allowing the ventilator's own logic, as in IntelliVent ASV, to use this data for its automated adjustments. This provides a holistic, single-source view for a complete patient assessment. Finally, all of this power is controlled through a highly intuitive and customizable touchscreen interface. Clinicians can easily rearrange the layout, prioritizing the parameters and graphics most relevant to their patient's specific condition. This flexibility ensures that critical information is always front and center, streamlining workflow and allowing the clinical team to focus less on the device and more on the patient. The Hamilton G5 is indicated for patients who require mechanical ventilation due to conditions such as indications: acute respiratory failure, ARDS, acute respiratory distress syndrome, severe pneumonia, post-operative respiratory depression, neuromuscular diseases that impair breathing, chronic obstructive pulmonary disease, COPD, exacerbations, traumatic brain injury, or other conditions requiring controlled ventilation. Contraindications. Although the Hamilton G5 is highly versatile, it should not be used when the patient has adequate spontaneous breathing and does not require ventilatory assistance. Airway obstruction prevents effective ventilation. There is untreated pneumothorax without a chest tube in place. Severe facial trauma or deformities make mask ventilation impossible in non-invasive mode. The patient refuses or cannot tolerate ventilation support despite all interventions. Clinical benefits of the Hamilton G5. In the complex and demanding environment of the intensive care unit, the primary goal of mechanical ventilation is not just to support breathing, but to do so in a way that protects the patient, promotes recovery, and simplifies the clinician's workflow. The Hamilton G5 is engineered from the ground up to meet these critical objectives. It integrates a suite of advanced technologies designed to deliver tangible clinical benefits, transforming it from a simple life support device into an intelligent partner in patient care. Let's explore the key advantages that set the G5 apart. First and foremost is improved patient safety. The G5 leverages intelligent automation to create a robust safety net, minimizing the potential for human error. Features like IntelliSync Plus continuously monitor for patient ventilator asynchrony and can automatically adjust trigger sensitivity or cycling criteria to resolve it, preventing the distress and potential harm caused by a mismatch between patient demand and ventilator delivery. Furthermore, the integrated IntelliCuff controller automatically maintains optimal tracheal cuff pressure, a critical factor in preventing ventilator-associated pneumonia, or VAP, by sealing the airway without causing tracheal injury. This constant automated vigilance frees clinicians from repetitive tasks and reduces the cognitive load, allowing them to focus on the patient as a whole. Central to the G5's clinical prowess are its advanced lung protective strategies. The risk of ventilator-induced lung injury, or VILI, from barotrauma and volatrauma is a constant concern. The G5 directly addresses this with its signature modes: Adaptive Support Ventilation, or ASV, and IntelliVent ASV. These modes go beyond conventional ventilation by using the patient's own respiratory mechanics, resistance, compliance, and expiratory time constant, to calculate and deliver an optimal breathing pattern. They automatically select the combination of tidal volume and respiratory rate that minimizes the work of breathing while adhering to strict lung protective rules. This ensures the patient receives tailored support that adapts in real time to their changing condition, promoting safer ventilation from intubation through to extubation. This leads to another significant benefit: enhanced patient comfort. The ventilator's ability to synchronize closely with the patient's own respiratory effort is paramount. Poor synchrony is distressing for the patient and often necessitates deeper sedation, which can prolong the duration of mechanical ventilation. The G5's highly responsive flow and pressure triggers, combined with the adaptive nature of ASV, ensure that the ventilator works in harmony with the patient. By accurately detecting the patient's inspiratory effort and delivering support precisely when needed, the G5 can significantly reduce the work of breathing and improve comfort, potentially decreasing the need for heavy sedation and facilitating a more natural breathing pattern. Finally, the G5 provides powerful, data-driven decision support. The large, intuitive touchscreen displays comprehensive monitoring data, from basic waveforms to advanced lung mechanics. The dynamic lung and vent status panels provide an at-a-glance visualization of the patient's condition and the ventilator's response. Clinicians can easily review high-resolution trend data for up to 72 hours, helping them identify patterns, assess the response to interventions, and make more informed decisions about weaning and therapy optimization. This wealth of integrated data transforms the ventilator into a powerful diagnostic tool, empowering the entire clinical team to provide proactive, evidence-based care at the bedside. In summary, the Hamilton G5 ventilator represents the highest standard in ICU respiratory support. Its combination of adaptive technology, safety features, and clinical intelligence makes it one of the most trusted ventilators in hospitals worldwide. From neonatal units to adult intensive care, the Hamilton G5 helps clinicians deliver personalized, safe, and effective ventilation for patients when every breath counts.